as I'm treating patients, right, those patients who are dying, to me, they are other people's family members. When they pass away, it teaches me that life can be quite fragile.
I'm Maggie, this is my husband Zach. We are currently serving as medical officers in Hospital Sungai Buloh COVID response unit. We were mobilised as part of the COVID response team due to the high surge in numbers of COVID patients. Even though we were previously also in the hospital setup, but being in COVID ward is totally different from what you might expect outside. You are not able to touch patients as frequent as you want. You cannot really inspect or do your clinical assessment on them. There are a lot of limitations to our treatment as such.
Every day we have to work around 12-hour shifts, and each time we have to be in full PPE for around 3 to 4 hours each time. By the time we doff off the PPE, we will be drenched in sweat. Sometimes even the most unfortunate things is patient can collapse, and then you have to conduct a full resuscitation on them, and it's a quite tiring thing to do. Thank God I have a strong family support. Every time I come home, I will share this with my family members and also with my wife, and they are very, very supportive. They will encourage us, they will motivate us.
As a doctor, it breaks my heart to see that I cannot do much for the patient, because I have had to deal with a lot of patients recently who are on the verge of succumbing to this disease. And as doctors, we are actually trained to prolong their life, find out solutions and find ways out to postpone this from happening. But with this disease, we're seeing a lot of people dying very quickly, just days when they come to us, and I think this has taken a toll on me. We have to deal with a lot of fear, a lot of panic, patients, family members. There are a lot of anger, a lot of resentment towards the disease. So there are a lot of barriers that we have to break in order to communicate, in order to actually discuss a lot of things with their family members, to be able to talk to their family, to be able to break the bad news to ailing patients, family members is the hardest part. One thing I really want to comment is that our healthcare system is actually very equipped to the extent that we are able to deal with a big load of patients in a short time. I think a lot of us were actually burnt out initially because we did not have enough human resource to help with the huge number of patients. Every department came to help. Most of the departments in Sungai Buloh was disbanded, and then everybody came to help from all different fields of medicine. Everybody actually chipped in. So you can actually see that despite having limitations such as the workforce, we had very, very little medical doctors to help with the sudden increase of patients, but we managed to pull through. We have been put here for this reason, and even though it is heart-wrenching, we have to go on. Because if it's not us, who else? And if it's not now, when else?
The only way to bring down the cases, to break the chain of the infection, is to, at the moment, prevent mass gathering, to stay at home, or if you have to work, try to work at home, work from home, and also most importantly to get vaccinated as early as possible. If you have not registered, please register through My Sejahtera. And for the elderly who doesn't know how to register, you can either go to the nearest clinic kesihatan or any private clinic and ask the medical personnel to help you register. The impact, I would say, it helps me to value life even more. So every time I come home And when I see my parents, it helps me to appreciate them even more for the things that they have done for us.
I view health as a very precious commodity, as it can be taken easily away from you. Many of us are very comfortable in our life. A lot of things are very easily available to us. But I think this pandemic has taught us that all these things can disappear in just a moment. So we have to always remember to give thanks for everything that we have, everything that we are enjoying right now. One of the ways to actually give thanks, to actually appreciate what you're having right now, is to actually prevent yourself and your family from getting COVID, and that is to actually stay at home.